Okay, let's go ahead and get started. Thank you guys for joining us today. We are going to go ahead and start with a few introductory remarks from Mayor Engen and Josh Slotnick.
Okay, thank you.
That's the newest.
And just a reminder to mute, please. I'm actually going to mute all of you right now.
Good. You need anything?
Well, thank you, Allison. Thanks, folks, for joining us this afternoon. So I prepared some remarks, which is a little unusual for me, but I want to get this right and emphasize the seriousness of this discussion today. When the global pandemic landed on this continent, the folks at this table, along with many others, began preparing for a long haul in the city and county. And we managed mixed messages from the federal government, did our best to deliver straightforward information to our residents. We became sophisticated scavengers when personal protective equipment was scarce. We navigated the complex waters of testing when supplies were short, demand was high, and information about the nature of COVID-19 was limited. And in cooperation with the state of Montana, we stayed home while working as hard as we've ever worked. And because most of us took this illness seriously, we flattened the curve. Case counts were low, and we found ourselves in a state of maintenance. Today, however, we need to shift gears. All of that fundamental work that the community did in the early days of the pandemic established a solid foundation for conversation, study, collaboration, and innovation around Missoula's response, which is necessarily fluid. Today, there are simply too many cases, though one case may be too many, of COVID-19 to continue business as usual or unusual, depending on your perspective. So today, our health officer, Ellen Leahy, will announce new restrictions that will be in effect on Thursday of this week. They are simple, straightforward, and effective practices to protect public health and safety. That does not make them easy or benign if you're in business in Missoula. But in our experience, businesses that have been leaders in best practices won't see much change in their operations. Businesses that have been largely ignoring guidelines and directives will see a change, but their employees, customers, and suppliers will be safer. Why now and why these restrictions? These orders are designed to meet these critical community goals, which are currently in jeopardy. We need to prevent uncontrollable spread. We need to keep schools open. We need to maintain hospital access. We need to protect high-risk populations, and we need to protect essential services. One of the key indicators here is the incidence rate calculated on a weekly average. We need to get to about 25 cases per 100,000 population for 2 consecutive weeks to stay on top of this thing. As of Friday of last week, our incidence rate was more than double that, and only by limiting spread do we mitigate catastrophe. Today, we're behind in contact tracing, a critical piece of business in preventing spread, and resources will only become more critical as this thing stretches on. And please remember, these are real lives that are affected. We have long-term care facilities in some cases in Missoula County nearly overrun with COVID. So many of you have done the right things over these many months, but if we don't redouble our efforts, we could tip over into a crisis that could make the difficult decisions that led to these restrictions seem trivial in comparison. In addition to these restrictions, I'm asking you to do your best to stay home as much as you can. Commissioner Slotnick and I spent the early portion of this pandemic reminding you on a daily basis all of the good things that people were already reminding you, and we're here to do that again today. This is a tall order, I know, and easy for me to say, but I'm going to do my best to avoid any situation where social distancing or other precautions aren't an option. Masks, hand washing, testing, all of it matters more today than it did in March. And we'll be measuring our progress and reevaluating restrictions based on evidence and the progress we're making toward critical community goals. Pardon me. If we make progress, we can consider easing restrictions. In the meantime, I want to thank those businesses that have been responsible leaders in the community despite the sacrifices associated with doing the right thing. And I'd urge others to follow that leadership. The more we do together now, the sooner we'll get to something that looks like normal and will ease a lot of human suffering along the way. I also want to thank our staff at Incident Command, Health Department, Health Board, and the many folks who contribute to these conversations and participate in the process that leads Ellen to make her decisions and orders. Commissioner.
Thank you, Mayor, and thanks everybody for joining in today. And before I dive in, I want to thank Ellen and her staff. I want to say working tirelessly, but that means they didn't get tired. No, they've been really tired. These people have been dedicating themselves 24/7 for months now in our benefit. Well, some of the things I'm going to say, the mayor said, and other people will say as well, but the message is really important, so I'm going to say them anyway. Ellen's about to announce these new restrictions, and the question should jump into anyone's head who's listening. Why? Well, as the mayor said, we're doing this right now so we can slow what otherwise would become an unstoppable spread. That's number one. Number two, we want to make sure and keep our schools open. Number three, we want to make sure we can maintain hospital access. Our hospitals are regional. That means it's not just our city and our county, but people from all around come to. We're a medical hub, which means we get people sent here who aren't from here. So we need to do our best to keep our numbers down so our hospitals can remain open. We also need to make sure that our most vulnerable people don't get sick, and that we protect our essential services. That's why we're doing this. Now, why now? It seems like it's been going this way for a while. Well, why now? Well, as the mayor said, the case numbers just got too high. And the case numbers being high means the contact tracing, really reaching out to all the people that sick people came in contact with, becomes almost impossible. Reaching out to all those people is the best thing we can do to slow this spread, to get people to alter their behavior and get in to get tested. And right now we've hit a spot where we can't effectively do that. So we got to bring the numbers down so we can effectively do contact tracing. So how long are we going to be at this? Well, as the mayor said, we need to bring our numbers down so at our 7-day average of new cases is under 25. And we'll take another look in 14 days, and then we can go another 14 days. That's the incubation period. And if we get there, we can loosen restrictions up. If things get worse, we got to tighten up. Either way, the time is now to implement these things. So last little bit I want to say is just ask yourself when you're going into any new physical environment, am I stepping into a confined space with shared air? So confined space, or is it indoor, outdoors? Is it all indoors? Is there big, good airflow or not? Shared air, are you sitting close to people, far away from people? If you feel like you're stepping into a spot where it's a confined space and you're breathing shared air, then don't do it. Even if it's your good friend's kid's birthday party or whatever it is, it's heartfelt. I've been in the same situation. Basically, right now, we got to hunker down. So many people in Missoula County have been doing the right thing for so long, it kind of hurts. Unfortunately, we got to turn the volume up on that. And if we do, 2 weeks from now, we get to loosen up. So thanks all for tuning in, and the people coming after will probably have better things to say. So there you go. Whoever's up next, take it away.
So I think that's me. I'm Ellen Leahy. I'm the director of the Missoula City County Health Department and have the statutory duty as appointed by the Health Board as health officer. First, I want to thank everyone who's listening, the media for getting the word out, everyone else, and all the people that stand behind them and aside them for all the work of getting us to a pretty good, but not good enough situation this many months into what promises to be yet longer pandemic for all of us. We have been doing well on a lot of things, and that's private individuals. Our schools are really doing well in bringing us protected environments. The university, many of our businesses. Unfortunately, the virus has gotten ahead of us. While that is not surprising, it is definitely time to act and to push back down on it. Where does the number, that 25 as our incidence rate, come from? That is a national metric. It's actually more than national. It comes from the Harvard Global Health Institute. And when you hit 25, you're actually in the red zone. So we are above the red zone right now. So here we have, I think Allison's going to put up a chart for us. Okay, we know from the literature that non-contagion strategies, so social distancing, wearing a mask, smaller groups, not mixing, using the outdoors when we can, that all of those things do work. The literature, as you'll read it in my order, which has some selected evidence in it, those work. Some of the things that work most effectively are isolation of positive cases, and we are doing well on isolation of positive cases, and we are improving, thank you everyone, on contact tracing for those that are exposed. And lockdowns or stay-at-home orders tend to have the strongest, most dominant outcomes. Nevertheless, we need the whole group of policies to work together. And so while we are not wanting or looking to a lockdown right now, we are looking at cutting certain sectors and activities in half from where we've been since the governor put us in phase 2 back on June 2nd. So looking at this diagram, I'd like you to first focus on the goal. We need to get to that 25 cases, 7-day average per 100,000 population, just think of the 25, just to get back into the red zone on that metric. We are currently at 51. When we started on these orders, in terms of just, looking at our data with the health board and then with the elected officials and schools, our epidemiological experts, it was only about a week and a half ago, and we were down at 33. I cannot impress upon you how quickly it went to 51, particularly when you're thinking of an average. So even though we are doing the right things, and we know that those things work, we need a little higher dose. We need to calibrate and push back harder. So as you continue to look at this metric, I think you've seen all the reasons why we need to do that are under purposes. And I'll go into the actual measures here in a minute that we'll use, or the orders that we'll use. And we will reassess once these orders go into place. We will reassess at the end of the first incubation period for this virus. So the orders will go into place Thursday morning, the 29th at 8 a.m. And we will do our first reassessment on November 12th. And we will look at it every other week and report out weekly. If you look in the center, if we meet that goal to 25, we can either loosen or lift some of these orders. So there are some other indicators that we look at. We want you to focus on the 25, but we'll make sure that other indicators that we watch, such as hospital availability, testing turnaround time, all of those things are still, some of which are not under our complete control, are still working for us. If we don't meet it, or as long as we don't meet it, we could actually need to tighten. If this incident rate, while we're trying to push down, spirals up, which it can do, because the incident, it takes 2 weeks for this virus to show itself as illness when it does show as illness. So it can already have transmitted in cases we're not yet seeing. So it is possible we would have to tighten things even further than we're going to discuss today, or at least continue them. It's not at all, won't be surprising if in 2 weeks, at the end of the first incubation period, that we will continue everything we're putting in place today. Not because we're not doing it well, not because it's not working, simply because it will be too early to see the very first effects of these orders. So 2 weeks is a long time to wait to see any effect, and it will take at least 2 weeks of staying at 25 before we feel we can remove them. In a nutshell, if you look at the lower left part of this particular diagram, the order includes, in addition to everything else we're all doing, we are going to basically, rather than do a full shutdown or stay at home, we are actually going to take it by a half and take where we currently are and have been since May, with business capacity down to 50% of what their highest typical capacity would be. That is not fire marshal capacity. That is operating capacity. Group sizes have been allowed up to 50 without distancing and masks. We are cutting that again in half to 25. We did think about going lower to 10. I want to take a moment to explain why we stopped at 25. There are structured settings, such as in parks and recreation and many other places in our community, where groups can get together, use masking, use distancing, disinfection, and they actually can conduct some of their social and physical activities in a structured setting. We have learned from our experience here in Missoula that the structured, organized settings, for as long as we can keep them open, actually do bring protection. We've seen that in our schools, we've seen that in our university, and we continue to see that. So we didn't want to move so tight at this point that we actually were disallowing people access to some structured settings, but we sure going to have to work hard to hold on to them. Alcohol service, bars will close at 10 p.m. And then we are asking you to stay home, travel in small groups. So much of our spread has occurred outside of structured settings. Please cooperate and try to limit that. What I would like you to ask, I would like to take this down just so I can do the highlights of the order, and I'll just read right down the list if we can unshare this. So the changes are events and gatherings are now limited to 25, and any group over 25 is required to check in with the health department before you try to plan your gathering. We don't want to find out about it because someone complained the day before or afterwards, and most people do want to cooperate. We are here to answer your questions and give you the very best ideas we have on how to run it as safely as possible. But you must check with the health department before holding any group over 25, any group event. Organizers for any event over 25 must have a written plan on how they're going to do it. A written plan is not, we're going to stay 6 feet apart. That is not a management plan. Organizers for any group over 250 must get our approval that that plan looks like it will work. None of these limitations apply to students in classrooms or other school-related activities, as long as it's not an audience or other spectators present. And none of them apply to voting activities. There are no restrictions other than the safe 6-foot distancing, masking, and disinfection that our election office is already using. There's no changes to personal care businesses like salons, retail businesses, gyms, places of assembly are limited to 50% of their typical customer volume. again, not fire code, and they must have a plan for how they're going to do that, a written plan. Restaurants and bars are limited to 50% of normal operating capacity. Table limit is down to 8 per table. And they must also post signs, because when we go into restaurants and bars, we take our mask off, and we should only be taking it off to eat or to consume the beverage. So we must post signs about the COVID requirements and reminder of symptoms. Bars and last call has to occur before 10 for any liquor service. This order will be in effect until it's revoked or revised based on our progress as a community in getting to that 25 incidence rate for 2 weeks. And that first look is November 12th. Thank you very much.
Thank you, Ellen. We'll have time for questions at the end, just an FYI for media. Dr. Rob Stanger with the Missoula City County Health Board.
Hello, everybody. I'm going to keep my remarks brief. My name is Rob Stanger. I'm the physician member of the Missoula City County Board of Health. And I just want to start by saying that I appreciate Ellen's consultation with members of the Board of Health, and we are fully in support of the orders that she's outlined. I just want to make a few brief points. Number one, I want to pick up on what Mayor Ingen and Commissioner Slotnick said, that the current rate of COVID disease activity in our community is just not sustainable. And I really want to emphasize with people that driving that rate down is going to be essential for protection of our healthcare infrastructure and their ability to operate and take care of people who are very sick, and also protection of those that are most vulnerable in our community, those that are older and people that have chronic conditions. The second thing I'd like to emphasize is that this is going to be a community effort. And for all of you out there listening, understanding the details of the new orders are important, but for everybody out there in the public, I think the most important thing are for all of you to continue doing the things that we have been asking you to do since the beginning of this pandemic. They're sometimes referred to as the 3 Ws. We need you to wash your hands, we need you to wear your masks, and we need you to watch your distance from others when you're out in social settings. I think the last thing I would just say is that I think that Ellen and her team at the health department have done a very good job of thinking about changes we can make in our community that are driven by evidence and science about coronavirus as we know it right now. We know that transmission is more likely to occur in settings where people are closer together, and in settings where doing those basic things are more difficult. For example, establishments where you're eating and drinking, you can't do that with a mask on, and we know that transmission in those settings is more likely. So I think that these orders are a good targeted effort to constrain the spread of the virus in our community while us continuing to operate and shop and go to school and go to work and all the things that we need to be doing. So I think I will stop there and let others speak, but just want to thank, frankly, everybody in Missoula County for doing their part.
Thank you. Next up, we have Joyce Dombrowski from Providence, Montana.
Good afternoon. Thank you for the opportunity to speak today. My name is Joyce Dombrowski. I'm the Chief Executive at Providence, Montana. I want to first thank the City County Health Department and Ellen in particular. This is a job that I don't think even can use the words in terms of understanding the time and the effort and really the intention to keep us all safe. I'd also like to thank the many caregivers, physicians, nurses, et cetera, that work every day at the Providence facilities. It is hard work. It's the wonderful work that we do every single day. And in fact, it's getting harder. The fatigue is very real. And I think my message today to you in the community is we need your help. You expect and should expect that we are going to be here for you to take care of you when you're sick. And we need your help to not put yourself in a position by not following the 3 Ws. Those 3 Ws are essential for us. Our staff actually is becoming impacted by the community spread. A real-time example, just today, we have 6 caregivers who are not able to come to work to take care of all of you in the hospital because they have been exposed through community spread to someone in their household. Our emergency department really is becoming overrun as well by individuals who are worried, who have felt like perhaps they have put themselves in a position that they didn't need to. We don't want you to delay care if you really have an emergency, but we do want to call you to action around the areas that we know you know. It's real. It's very real. I live it every day with my colleagues here at St. Pat's, St. Joe's and Polson in our clinics, and certainly with our colleagues at Community Medical Center. We meet every day as large hospitals in the state of Montana and talk about the hospital capacity. And honestly, we're doing fairly well in Missoula comparatively, but we're not doing well enough. And the surge of the last couple of weeks has been dramatic and it's been exhausting. And I would just want to have a plea to you again. Please help us. Please don't overrun the system, and please follow the rules that you know are so impactful. Thank you.
Okay, thank you. Up next is Dean French with Community Medical Center.
Good afternoon. I'd like to thank you for the opportunity to speak on this very important topic today. First, I'd like to extend a thanks also to the Missoula pitch in together like we have in the past. This community is going to be fine. Our healthcare system will be strong and will continue to be able to take care of our community. I ask for your help and support, and I thank you for the opportunity to speak today. Thank you.
Thank you. Rob Watson with Missoula County Public Schools.
Good afternoon, everybody. Hopefully you can hear me. Thanks for the opportunity. My name is Rob Watson. I'm the superintendent of schools for Missoula County Public Schools. Just my pleasure to make a few comments today about how things are going in the schools. I would say overall, we're doing pretty well with our transmission in schools. So far this school year, we've had 82 cases since the start of the school year. Those 82 cases among students and staff. But remember, please, we serve about 9,000 students and staff together. So 82 is not too bad since the start of the school year. We currently have 15 active cases in our school communities, and that includes all 18 of our schools. So 15 active cases is far less than the number of active cases that you would see per 10,000 in the community. We've also been tracking through case investigation, we've been tracking the route of transmission. What we've noted is about 81% of our COVID cases since the start of the school year have been, the route of transmission has been outside of school. So we do not believe that transmission is happening very much in schools, if at all. And we'd like to try to keep it that way. One of the things I just want everyone to know, though, is that COVID is still impacting us. As cases go up in the community, we see more students and staff that are on quarantine due to close contacts outside of school. And just as was mentioned from the hospitals, if we have too many staff that are out, we may have to close a school or put a school on remote learning because of the lack of substitutes and lack of staff in a particular school. I believe that will likely happen more quicker than just closing a school because of COVID cases among students. It's likely going to be because we can't staff a particular school building. Also, I just would hope as an educator that we as a community could prioritize keeping our kids in school over anything else. As the case numbers go up, I do fear that we may be forced to go back to full remote learning like we were last spring. But we know that kids need much more than that. They need to be in school for not only for academics, but social, emotional learning and health, as well as important access to other things like food and counseling services. So I think as a community, I think it is important for us to prioritize having our kids in school. I would hope the community understands that the importance of getting this under control for the sake of our schools helps us keep kids in school. We do know that because of the low transmission rate that we're seeing in school, we do know that the structured setting of school is actually protecting our students and our staff, and we'd like to keep doing that and keep schools in session. So Thank you very much for the opportunity to speak.
Okay, thank you. Up next is Grant here with the Missoula Economic Partnership. I think you're muted, Grant. I still can't hear you. Great. Try again.
Hi, Grant. Sometimes Teams has these little hiccups. Maybe if you try, sorry, this is kind of a pain. Maybe if you try hanging up and coming back in, it might be fixed.
Okay, sorry about that, folks. Hopefully he'll get back in and we're able to hear him.
Maybe Grant didn't get picked for the team, Allison. We need to.
Okay, let's try again. Tammy or Sarah, are you unable to mute him on your end?
No, we're not able to unmute people. Maybe if he checks his permissions and settings. Sorry, I don't really know what would be causing this.
Tammy or Sarah, can you try to call him through Teams?
Yeah.
Thank you.
So yeah, Grant, maybe if you hang up, I'll try to call you in, or yeah. Let's try that.
Is there a Teams number that he can call in just to speak by phone? We had to resort to that during a board meeting recently.
Yeah, we might have to have him do that. I think Emmy's gonna try to
We won't
get
see
him
him,
right now, but
Yeah, I think we'll probably have to try that. Yeah, okay.
Hey,
I'll see if I
Ellen,
can-
Ellen, this is Josh. Did you see the email I just sent you? You take a look.
Not a chat, an email?
An email, just about some numbers. It's pertinent to our discussion here right now.
Okay, hold on.
Thank you.
I,
Allison, was Grant our last speaker?
he was, yeah.
Okay,
So, okay,
Grant.
sorry about. Oh, you're here now?
I'd suggest we take questions, and if we get Grant back, we'll get it back.
This is Grant on the phone. Can you hear
You
me
got
at this
him.
point?
Oh, we can, Grant. Great.
Welcome back, Grant.
So Yes, fortunately, I have a face for radio, so we'll stick to my voice on the phone. I wish I could promise that what I have to say was worth the wait, but I'll make some remarks anyway. And let me just start by saying that all of us at the Missoula Economic Partnership want to thank and acknowledge the many businesses that are doing so much to follow the existing guidance to date. This has not been easy. It's taken real commitment from business owners and a huge effort from frontline workers to follow the guidance that exists already. Unfortunately, when cases go up, spending in our community goes down, and our businesses are the first to tell us that they lose customers when our community experiences increased COVID spread and heightened fear. This is confirmed by a study released just this month by the National Bureau of Economic Research. It's also confirmed by Google Analytics, which show that as cases have risen since late summer, Montanans are spending 16% more of their time at home. When cases go up, our workers are more likely to get sick, and businesses in which they work are more likely to be forced to shut because they don't have a healthy workforce. If we reduce cases and the risk of spread, we reduce financial losses to our local businesses. The best thing our community can do to support our businesses is be extra vigilant over the next few weeks so that we can reduce spread and get back to capacity as soon as possible. We know what works. We talked about the 3 W's: wear a mask, limit group activity, maintain 6 feet of distance, wash your hands, and stay home if you're not feeling well. If we do these things now, we can get past this spike in 2 to 3 weeks. We all have a role to play in beating the virus. I want to say one last thing about Rob Watson's comments. And keeping our kids in school and in daycare is essential for our children's sake, but it's also really important for our business community. So many of the people who need to go to work every day depend on sending their child to daycare or to school to do that. We've got to protect those places where we send our children so that people have the ability to make it to work, to put food on the table and a roof over their head. Thank you.
Thank you, Grant. All right, now we'll open it up for questions from the media. You all should be able to unmute yourselves. Your question. Griffin, do you have a question? You should be able to unmute yourself.
Yeah, thank you. My question is, could you explain a little bit more about the voluntary quarantine or voluntary stay-at-home order and how it differs from the status quo right now?
I can take that. It doesn't differ from the status quo. What we're here today doing is we're attempting to emphasize that that will make a difference. Our ability as a lone county to do a stay-at-home order is considerably tempered by what happens in adjacent counties, and it just doesn't work on a county-by-county basis. A true stay-at-home order needs to happen at the state or federal level. But what we're doing today is our best to encourage you to engage in some of those practices that we engaged in when we were first facing this thing, because it is effective.
Thank you.
Thank you. Emily Adamson, you're unable to unmute yourself?
Yeah, I think so. This is Emily Adamson over at ABC Fox, Montana. Ellen, I'm hoping to get a little bit of clarification on that 7-day average. So the goal is that the 7-day average needs to be 25 cases or fewer for 2 consecutive weeks. Is that accurate?
That's correct. That aligns with the 14-day incubation period for this particular virus. So we have to, yeah.
Perfect. And then one more quick question. You touched briefly on, or you mentioned gyms, personal care facilities, things like that. Obviously, they'll have to comply with the 50% capacity. Wondering why there were no additional restrictions on businesses like that where there is close contact or indoor activity.
Well, there's no changes in this order to personal care. You may not recall, I recall vividly, that when the governor opened up into phase 1, we here in Missoula held off on opening personal care until we got some local input on some safety practices. And we put all those in place back in, I don't know, I think it was April or early May. So those remain in place. And that was the masking, all of that was pre-masking rule, pre-masking order. Those are already in place and will remain. The gyms, however, did have a different set of opening. I can't recall them all from phase 1 to phase 2. But at this point, we do need them to go to 50%. They are allowed to take their mask off for strenuous activity. Unfortunately, depending on where you go and what reports we get, sometimes people think that as soon as you enter a place where you can take your mask off, such as a coffee shop or a gym, that you take it off and leave it off the whole time. I'd like to use this opportunity to say no. Keep it on until you actually are eating or drinking. And if you're in a gym, there are moderate level activities that aren't as strenuous that many people can keep a mask on. So that goes beyond your question, but I did want to emphasize that we did talk about requiring masking in gyms and decided at this point we would try to clarify what is currently required.
Thank you so much.
Ellen, for the good of folks gathered here, would you remind us of what restrictions are in place for high school sports?
Those are governed. I'm not sure they're actually governed, but to play high school sports, the schools have to belong to the Montana High School Association. And that association sets the what sports are going to happen and how they're going to happen. And early on, the health officers of the largest 7 counties did advise that certain face-to-face sports not occur in the fall, but the Montana High School Association did go ahead with those. So what we focus on here is the spectators. And then, of course, when we do get positive cases among teams, we deal with the school and the quarantine related to that. I don't know if Dr. Watson could add to that.
Yeah, I don't necessarily have anything to add to what Ellen has said.
Henry?
Hi, this is Henry from the Silly Swan Pathfinder. I wanted to ask, how should already planned events submit a plan with the health department? And if an event is outdoors, is it more likely to receive approval?
No, it's not that it's more likely to receive approval. It's going to generally be safer, but you will still be required, just because of that environment. Outdoors will be safer. Not that you cannot be infected outdoors, you certainly can. But you're not rebreathing the same air as you are indoors. So that planning will now go down to 25-person pods instead of 50. We still will require masks, other social distancing, and in attachment A, which many of you may be familiar with, all those same requirements have to be met. And your plan, instead of being recommended, is a requirement. And if you go above 250, if you're planning to, then we must approve it. So that has become more assertive and more restricted.
And where do they go to submit a plan?
It's in the order. There is an environmental health email that you can click into, and then there's 258-4755, which is the main desk.
All right, thank you.
Rita?
Thank you. Alan, I'm wondering if this means increased compliance checks around town. I know you guys have been doing that already. Will you step that up?
Well, we have been stepping that up, and we are I think, pretty close to hiring yet 2 more people to do that, but they will be doing plan review and consultation. Most of the folks we work with just want to know how to do it right. That's like 80%. But we will continue to the extent possible, especially with additional staff, to do unannounced compliance checks. We tend not to start there. We tend, particularly with new rules, to start with working with the business to see how compliance can be brought about.
And then to follow up on that, I'm wondering if you guys have been working with the state on enforcement help, either through COVID relief funds or other assistance.
I have inquired about a new pot of money for COVID relief enforcement. There is actually not a new separate pot of money. We are simply allowed to use the latest grant coming our direction to do that. And we should be receiving that amount soon. But it's the same money that we are using toward the many other expenses that we have that are not FEMA reimbursable, such as testing, contact tracing. None of that is currently FEMA reimbursable and relies completely on CARES Act funding, which, as you're aware, ends in December. But we are planning forward because these are all very necessary actions regardless of the predictability of federal funds at this point.
Megan?
Ellen, Megan with KPAX. I don't know if you want to pass this on to Joyce and Dean, but can you give us some specifics on hospital capacity and maybe how close they are to running out of space and hospital beds?
There are some publicly accessible indicators that the state health department is now publishing. So you can look at those. I can't give you that website right now, but other than that, and of course we watch it daily with them, we get reports from them. Other than that, I would defer to Dr. French or to CEO Joyce Dombrowski.
Okay, perfect.
This is Joyce. I would have said exactly what Ellen said. We actually report into a state database on a daily basis, and that would give you the most accurate information as to our capacity.
Okay, thank you, Joyce.
This is Dean. I would echo that. I would also just emphasize that our capacity is not just physical bed count, but it's our ability at both facilities to provide competent and trained staff to take care of patients in those beds. That's part of our plea today to help flatten the curve in the community so we can make sure we have the workforce we need to take care of folks. So our capacity is fluid and not necessarily reflected completely in the data that the state has.
Okay, thank you guys.
Hi, this is Rachel Kramer with Yellowstone Public Radio. I was curious if the health orders affect places of worship.
Anything that's not exempted in there specifically or explicitly is affected, yes.
Sorry, does that mean that places of worship would they be under the 25-person gathering limit?
I will have to double check with our attorney. My understanding of where we left it and tried to write it was the 50%. But I will have to put a caveat out there until I can be more certain.
Okay, thank you.
Peter? Peter, are you unable to mute yourself, or I don't know if we can? I don't know. Peter Christian, you have your hand raised, so if you have a question. I guess not. Do we have any other questions from the media? Okay, well, thank you guys for joining us. I believe the order is posted on MissoulaInfo.com already, but I'll be sure to send a link out to that, and I will send the slide that Ellen shared, and this will also be posted on YouTube later on our YouTube channel. Thank you.
Thank you very much.
Allison, there is a
Yes.
question in the chat bar.
Oh, there is? Okay.
There's a
thank
question
you.
in the chat bar.
Okay. From Commissioner Barrow? That's the only one I'm seeing. Is that what you're talking about,
Yes,
Sarah?
that's the one I.
Okay.
Yes, it is.
Okay. Okay, are we aiming for 25 cases over 7 days or 25 cases per 100,000 people for 14 consecutive days?
So Dr. Stenger answered that. Maybe he could answer that out loud.
Sure, I would be happy to. So for those that don't like math, I'm sorry about this answer, but our goal is to get the rate of new cases down to below 25 new cases daily adjusted per 100,000 population. So, Evelyn, I'm not sure what the base population rate is for Missoula County that we're using to calculate that 25 per 100,000, but we want to get it down below 25 cases per 100,000 and keep it there for 14 days, which is the incubation period for coronavirus. And we use the averaging, the 7-day averaging that's referred to in the order, just because daily case numbers can be highly variable, and averaging the amount of new cases over 7 days give us a much better picture of the overall trend of disease activity in the community.
All right, thank you. Any other questions?
I just want to add the metric, including the 7-day average that Dr. Stenger just reviewed. The target is the metric put forward by the Harvard Global Health Institute. You will also see in the order a place that you can click onto and actually look at Missoula County or any county or state in that active map that particular Global Health Institute does keep for COVID.
Here, Inga, did you have anything else to add? You clicked on there. No? Okay. All right, well, thanks for joining us, everybody.